uterine bleeding. So let me define you. What is a normal uterine bleeding? You all know we female, we start menstruating at around age of 15 and it continues till the age of 45. We get this monthly cyclical bleeding or period or menses or charms that happens during our reproductive age group. Now when it becomes abnormal, when the cycle happening at delayed interval. The normal interval, you must know, happens at around 21 to 35 days. So if a lady is getting her menses after 35 days, that's abnormal. And similarly, when the bleeding is coming in less than 21 days interval, it's also abnormal. Bleeding usually lasts for less than 7 days. So if it lasts more than 7 days and it's a heavy bleeding, definitely it's abnormal. There shouldn't be any bleeding in between two periods. So if there is spotting or bleeding in between two menses, it's abnormal. If bleeding happens while you're having sexual intercourse, after that you're having spotting, it's definitely abnormal. And also, if bleeding occurs from uterus after a lady has attained menopause. So in this situation, you must consult your doctor. You are suffering from abnormal uterine bleeding. Now this abnormality can be due to some local causes or can be due to some systemic causes. So what are the local causes? As you all must have heard the name of fibroid uterus. Fibroid is very common cause of this abnormal bleeding. It can be due to polyp, either endometrial polyp or a fibroid polyp. Or if the uterus as such increases globally in size, we call it adenomyosis or endometriosis, that can also give rise to this abnormal uterine bleeding. Now these are the benign conditions. There are certain malignant conditions that can give rise to this abnormal bleeding. That can be endometrial malignancy. Endometrium is the inner lining of the uterus, or it can be due to cervical malignancy. Cervix is the mouth of the uterus. Now coming to the systemic causes. The systemic causes can be abnormality in ovulation. You must have heard about polycystic ovarian disease. That happens if the ovulation doesn't happen on time. If it is delayed, the cycle will be delayed. So ovulatory causes is one of the very common cause of this abnormal uterine bleeding. Or it can be due to certain other hormonal abnormality, namely thyroid or prolactin hormone disorder. Now it can be due to the clotting disorder of that person. The blood fails to clot. Sometimes due to uncontrolled hypertension, especially in the postmenopausal lady, that can give rise to this abnormal uterine bleeding. Or very commonly, you must remember this, when you are on some hormonal medication, you should not stop it on your wishes. So irregular use of these hormonal drugs can give rise to this irregular pattern of bleeding. So you consult a doctor, he or she will ask about your bleeding pattern. So from there we try to find out what kind of abnormality you are having, and then we examine you clinically. If we find any local pathology like fibroid or polyp or adenomyosis or some growth in the cervix, this kind of things are detected clinically. Then we go with some investigations. You all know the first investigations is ultrasound, where we see the size of the uterus, whether there is any fibroid, polyp, adenomyosis, ovarian cyst, and we measure the thickness of the endometrium. Endometrium is the inner lining of the uterus. So ultrasound gives us enough information. We take the endometrial sampling, the layer from which the bleeding is happening. Endometrial sampling is an OPD procedure. We also do take a pap smear, which is a scraping from the mouth of the cervix to detect whether there is any cervical pathology. The next investigation of choice is a hysteroscopy, which is a gold standard. We put a scope, very small, 4 mm or even smaller than that, inside the uterus, and we examine the layer endometrium, which is inside the uterus, and we take a scraping, a biopsy from there if needed. Other advanced investigations, what we can go ahead are CAT scan, or we call it CT scan, or an MRI, when we are thinking about endometriosis, adenomyosis, or in cases of malignancy. Now what are the treatment options? Definitely it's with medication. The tablets, what you say in common word. So these medications are used, some are non-hormonal and some are hormonal. So this non-hormonal medication like tranexamic acid are very commonly used to stop this bleeding. Hormonal medications are often used. Those can be the oral contraceptive pill. Oral contraceptive pill has got great effect in this abnormal uterine bleeding to regularize the cycle. We can also use progesterone tablets, progestogen tablets orally to control this bleeding. Progestogen can be used in the form of injections. Progestogen can be used in the form of intrauterine implant, which is very commonly used nowadays. Other injections are GnRH injections. Certain minor surgical procedures that can also be performed. Now, these are when the endometrium is hyperplastic, we can ablate the endometrium by thermally. That's called thermal ablation of the endometrium. Now, if we detect if it is due to a fibroid, we can treat with medicine. Today, medicine is available to reduce the size of the fibroid. Now, if it doesn't work, we can go for advanced form of therapy. That's embolization of the feeding vessel, the vessel which is giving blood supply to the fibroid, that can be coagulated, this embolized, and the fibroid gradually reduces in size. Now, if it doesn't happen, we can go ahead with removal of the fibroid. That's a major surgery. We call it myomectomy. Now, with all this kind of treatment, with oral medication, injectable, implant, and with this minor surgical procedure, most of the cases, they get treated and cured. Now, if the lady has completed her family, she is of advanced stage and not responding with this kind of therapy, then we offer her the major operation, that's hysterectomy. And if unfortunately any malignancy is detected, definitely there is therapy, either surgical or other form of like radiotherapy or chemotherapy. So whenever you are having this kind of abnormal bleeding without any delay, please consult your doctor.